Our next innovator is Dr. Heather Maeker, Senior Vice President at Aarvik Therapeutics. Dr. Heather Maeker has over 15 years of drug discovery and development experience in oncology, inflammation, and infectious disease. Heather obtained her Ph.D. from Stanford University, where she received the AACR Young Investigator Award. Dr. Maeker continued her drug discovery efforts at Genentech, contributing to the development of small and large molecule therapeutics for oncology with the filing of numerous INDs. Notably, she is also a co-inventor of the PD-L1 immunotherapy Tecentriq. Dr. Maeker moved to Gilead, where she oversaw the development of both small and large molecule immunotherapies for oncology and infectious disease targets. Most recently, she led oncology drug discovery efforts at Aarvik, overseeing the creation and development of engineered oncolytic viruses and autologous, as well as allogeneic cellular therapies. She is a co-inventor of 23 filed or issued patents and co-author of research publications in Cell, Nature, Immunity, Nature Medicine, Cancer Cell, and Science Signaling. Dr. Maeker also serves as a faculty member and mentor for Science Gurus, a nonprofit organization that fosters and development of the next generation of scientists. With that, I'd like to call Dr. Maeker onto stage, please.
Thank you for that very kind introduction. I'm honored to be here today to present to you on behalf of Aarvik Therapeutics, where we are developing the next generation of antibody-drug conjugates to treat cancer patients. Now, antibody-drug conjugates marry the precision of antibody-mediated tumor antigen targeting with potent cytotoxic payloads, creating a targeted delivery vehicle for malignant tumors. At Aarvik, our next generation platform evolved from our co-founders' discoveries of site-directed payload conjugation chemistries invented by Jagat Janantala, present here in this audience today, as well as our co-founder Dev Sidhu with antibody engineering advancements. We have assembled a world-class team with greater than 200 years combined drug development experience. In today's presentation, I will review the current limitations of current antibody-drug conjugates and how Aarvik is innovating to overcome these challenges. Notably, we have created fully human antibody libraries with greater than 10 to the 10th species for therapeutic selection. Utilizing these binders, we then assemble novel tetravalent metabiologics. Finally, with these differentiated tetravalent antibodies, we conjugate proprietary cytotoxic payloads to create the next generation of ADC molecules. Now at Aarvik, these advancements are made possible by the world-class team that has been assembled. This starts with our board that includes our co-founders Jagat Janantala and Dev Sidhu, chaired by seasoned VC executive Anula Jaishree. Included on our scientific advisory board is SAB Chair Richard Scheller, former head of research and development at Genentech Roche, Bruce Roth, the inventor of Lipitor and numerous other small molecule medicines, Pooja Sapra, Senior Vice President of Oncology R&D at AstraZeneca, and Stuart Lutzker, who oversaw the clinical development of many approved oncology medicines, including the ADCs Kinsella and Polivy. Now, engineering the next generation of ADC medicines starts with target binder identification from our optimized common light chain antibody library, created and developed by our co-founder, Dev Sidhu. This fully human antibody library has greater than 10 to the 10th antibody species, all sharing the trastuzumab common light chain. These binders have been optimized to have good drug-like properties and low immunogenicity risks due to utilization of this very well characterized antibody framework. Now, with these identified binders, we next assemble novel tetravalent antibodies that we call MUTA. That stands for multi-specific trastuzumab-like tetravalent antibody. These tetravalent biologics can bind up to 4 unique tumor antigens. They have good drug-like properties with streamlined manufacturing processes that have already been established. Now, while there has been recent excitement in the ADC field with the recent approvals of Enhertu and Trodelvy, significant challenges remain in optimizing ADCs to be more effective in the solid tumor setting. One significant challenge is the lower target antigen density expression of many of the solid tumor antigens. Higher target antigen expression is required to trigger efficient ADC internalization with subsequent payload delivery to tumor cells. Tumors with lower target antigen expression show reduced ADC internalization with lower cytotoxic payload delivery with a reduced efficacy benefit. Now, whereas the approved ADC Enhertu targets the HER2 antigen expressed at 1 million+ copies per malignant cell, our Trodelvy that targets the TROP2 antigen expressed at hundreds of thousands of copies. Many of the solid tumor antigen targets are expressed at tens of thousands of copies or less. Now, at Aarvik, our ADCs are designed to overcome many of the current challenges of current ADCs. Notably, our multi-targeted biologic is capable of overcoming target antigen density by targeting more than one tumor antigen and more than one epitope of a given antigen with enhanced internalization properties. In addition to target antigen density, many of the current ADCs employ high potency payloads that limits the biologic exposure, especially for antibodies targeting solid tumor antigens. At Aarvik, we developed lower potency payloads that have been specifically optimized for the solid tumor setting. Lastly, most ADCs employ non-specific amino acid conjugation, resulting in heterogeneous ADC drug products. At Aarvik, we employ site-specific payload conjugation, generating a homogeneous ADC drug product linked with improved pharmacokinetic and safety profiles. Now, our differentiated antibody drug conjugates start with advancements in the antibody. Notably, our novel tetravalent biologics possess IgG-like properties that can target up to 4 unique antigens against 2 different tumor antigen targets and 2 unique epitopes. These generated tetravalent antibodies demonstrate enhanced internalization properties over that of standard Ig biologics. Now, on this slide, we demonstrate our streamlined manufacturing process of our tetravalent biologics, where following a single-step protein A purification, we can generate a highly purified biologic with minimal aggregation. Additionally, when we characterize the stability of these antibodies, they have melting points very comparable to standard Ig antibody, shown on the left, or the industry standard Ig antibody, trastuzumab, shown on the right. Additionally, we have also characterized the pharmacokinetic properties of these tetravalent biologics in animals. Our MUTA tetravalent biologics have very comparable PK to the industry standard Ig biologic, trastuzumab. Additionally, we have also tested the functional activity of these tetravalent biologics. An example of this is a MUTA tetravalent biologic that targets two unique epitopes of two different tumor antigens, HER2 and EGFR. Where on this cartoon on the left, you see a binder against epitope 1 of HER2 in the top panel, epitope 2 of HER2 in the lower panel, epitope 1 of EGFR in the top panel, and epitope 2 of EGFR in the lower panel. All of these tetravalent biologics purify as a single peak on SEC. Next, we assess their functional activity by their ability to block pro-survival signaling as measured by ERK phosphorylation in the presence of a pro-survival ligand. And what we found is that the individual Ig antibodies were unable to block. The bispecific antibodies were only able to partially block. But in contrast, our tetravalent biologic was able to completely shut down pro-survival signaling in cancer cells. Last, we tested our biologics for their key functionality, their ability to induce internalization. Now, internalization is a key function of antibody-drug conjugates required to deliver their cytotoxic payload inside of cancer cells. So what you see here on this graph is a tetravalent non-antigen binding control shown in red. And what you see is the robust internalization of the trastuzumab IgG antibody in cyan. But what's really impressive is the significantly superior internalization of our meta-tetravalent biologic shown in green over that of the trastuzumab biologic, which is employed in the approved ADC and HER2. Now, in addition to optimizing the antibody, we have also optimized the conjugation chemistries for payload attachment. Now, whereas most ADCs employ non-specific amino acid conjugation, at Aarvik, we employ site-specific conjugation that was pioneered by our co-founder, Jagat Januntala, that has been shown to both improve the pharmacokinetic properties of ADCs as well as their efficacy. So what you see represented here is several standard IgG1 biologic antibodies, bispecific antibodies, as well as our tetravalent biologics that we engineered to have a 4-payload drug attachment. And what you see is that all antibodies purified as a single homogeneous product with this defined 4-drug load. In addition to optimizing conjugation, we have also optimized and developed proprietary payloads specifically tailored and developed for the solid tumor setting. So what you see represented on this slide are various payloads that have been utilized in the clinically tested ADCs. On the very far left, you see the highly potent TBD payload, only one of which has made it to regulatory approval. And in the middle sector, you see the topoisomerase chemotherapeutic payloads DXD and SN38 that are used in the clinically approved ADCs and HER2 and Trodelvy. Now, our proprietary payloads that we have developed at Aarvik fall in the potency range of the approved ADCs and HER2 and Trodelvy. So what you see here on this slide is a novel proprietary linker payload developed at Aarvik attached to either a cleavable linker, linker 1, shown in purple, or a non-cleavable linker, which is actually shown in green, compared head-to-head with the Enhertu ADC. And what you can see is that our cleavable linker payload demonstrates enhanced potency against HER2-positive cancer lines over that of the approved ADC, HER2. Now, in addition to these payloads represented on this slide, we additionally have additional payloads that are both lower and higher potency that can be actually utilized and tailored to a selected program of choice. Now, in addition to developing novel proprietary payloads, we have also assembled a panel of cleavable hydrophilic linkers. Our next generation hydrophilic linkers are ones that have been demonstrated to have good plasma stability, as well as be cleaved inside of the tumor lysosomal compartment by enzymes such as cathepsins and glucuronidase. Additionally, additional hydrophilic groups have been added to these linkers to ensure that our ADCs have good drug-like properties. Now, in addition to optimizing the antibody conjugation payload and linker, significant care is put into the selection of targets that we develop for therapeutic ADCs. Notably, we select individual targets based on their biology and their significant overexpression in tumor tissue with minimal expression in normal tissues of concern. Example of two programs demonstrating target pair selection is shown on this slide, where in the right panel on the top, we see two target pairs that have been selected for a prostate cancer program, and the lower right panel demonstrates two target pairs that have been selected for a heme malignancy program. The individual antigens are shown in the green and orange sectors. And what you see is you see significant overexpression of the tumor antigens in the respective tissue relative to other normal tissues. Now, in addition to looking at target antigen expression in normal and tumor tissues, we also interrogate the biology of our given antigens, as well as if there's any clinical or safety data found on them, and incorporate all of these findings in our developed ADC therapeutics. And notably, our multivalent biologics are engineered to have standalone activity against a single tumor antigen in the case for a tumor cell where maybe only one of the antigen pair is expressed. So, in summary, at Aarvik, we are advancing the next generation of antibody-drug conjugates to treat cancer patients. Our novel ADCs can target up to 4 unique antigens and demonstrate enhanced internalization over that of standard IgG ADCs under investigation today. We have created and validated novel proprietary payloads to attach to our biologics. To date, we have already partnered a program with an industry collaborator and have lead assets identified for several programs. We believe that these MUTA ADC biologics represent the next wave of oncology ADCs that have the potential to significantly improve the therapeutic outcomes for patients living with cancer. I'd like to conclude by thanking the organizers for this opportunity to speak to you today on behalf of Aarvik Therapeutics. Thank you.